Je demanderai.
I would like to ask you all, I'd like you all to sit down, please, and then we can start the meeting. We don't want to get too far behind on our agenda. So, on behalf of the Presidency, I'd like to welcome you to this conference. The topic is the combat farmers are fighting against antimicrobial resistance. Now, I will tell you about the languages available for interpretation today. So we have 6 languages available. We have French, German, English, Italian, Spanish and Dutch. So you can therefore speak and listen to those 6 languages. And you can see the channels displayed on the screen at the back of the room there. Antimicrobial resistance is a challenge for public health, but it's also important that people who are responsible for animal health take up their responsibilities as well. This applies to both the farmers and the veterinarians who day after day work hard for animal health. They need to use all of the resources available to them to achieve their aim, i.e. biosecurity, implementation of hygiene measures, prevention, and finally, reasonable use of veterinary medicines, including antibiotics. The aim of this conference is to show how farmers and veterinarians can work together in order to minimize the risk that there would be the emergence and spread of antimicrobial resistance in the animal production sector, which produces a large share of food. The Luxembourg presidency would like to thank the FESAS, the European Federation for Animal Health and Animal Security, which organised this event. We'd also like to thank the European Commission for the moral support and logistical support, which has allowed us to organise this conference. And the Commissioner responsible for Health and Food Safety, Dr. Vitnes Andriukas, will attend this afternoon's session along with the Luxembourg Minister for Agriculture, Mr. Fernand Etienne. Antimicrobial resistance is an international phenomenon, and we have it described by experts as a plague of the 21st century that we need to tackle with all the resources available and at all levels. And so I'd like to invite you to listen to the message from the OIE. It's a message from their Director General, Mr. Bernard Vallon, and unfortunately, because of a very important meeting at headquarters in Paris, is not able to attend today. However, he did want to send us a video message. Good morning. Thank you very much for giving us the chance to comment on this very, very important topic. The important topic of antibiotics. Antibiotics are an essential tool in animal breeding. More than 20% of animal breeding produce is lost due to diseases. And so antibiotics is very, very important when it comes to animal breeding. It's important for animal welfare as well, because an ill animal is an animal that does not have a good welfare situation. Antibiotics, however, are also a hidden problem, because if they're not used properly, they can lead to irreversible situations whereby an ordinary operation on an animal or on a human can lead to a situation where bacteria continue to grow. Now, this is an international problem. There are more than 120 of our members that don't have legislation on the control, production distribution and use of these products. They are just used as ordinary goods. And so, it's possible that the bacteria is brought in some other way through tourists or whatever. So we need to have a global vision of what's going on. And we need to make sure that support for every country in the world is a priority to make sure that everybody adopts the right practices. So we want to highlight the danger of risky production methods. For example, there can be counterfeit products, or the information on the label is not what you have in the product. And this world trade is increasing. These counterfeit goods are being traded almost as much as narcotics are. Then you need to think about internet sales. These are increasing rapidly. And it's very difficult to cut them out. So what do we need to do? Well, we need to make sure that all of the farmers across the world are aware of the risks of unreasonable use of antibiotics. And you also need to remember that veterinary supervision can also be a source of abuse when it comes to the use of antibiotics. Veterinarians who are well informed and well supported and who apply professional ethics need to be alongside the farmers. The vets are not the problem, they are the solution at global level. And I would like to advise farmers to make sure that the antibiotics that they use are high quality antibiotics, and to make sure that they don't come from a source that's not checked, from a source where the labels and the contents have not been checked by the appropriate bodies. And I'd like to advise farmers as well to do something else. This is a product that's not just a trivial product. I'd like to ask farmers to keep registers. Now, this is something that the EU is already doing, but the OIE wants this to become an international practice. And I do know that farmers across the world share the same interests, and they should all be trained to make sure that they can preserve what is a public good, namely antibiotics. So I wish you a very fruitful day, and I'd like to thank you very much.
Je tiens à remercier le Dr Bernard.
Well, I'd like to thank Dr. Bernard Valla for his commitment to fighting antimicrobial resistance in his organisation, which is working very closely with the WHO. This shows that there is a close link between veterinary medicine and human medicine. And one of the slogans of the OIE is that animal health is important. Now, we've just heard from a representative of the international level, so now I'd like to ask you to focus on what we're doing at EU level. And so I'd like to invite Mr. Koen van Dijk to take the floor. He is the head of the unit that works in the rapid alert system, and he's going to tell us what the Commission is doing in order to improve use of antibiotics in veterinary medicine.
Thank you and good morning. And first of all, I want to thank both FESAS and the Luxembourg presidency to put this important topic on today's topic for the conference. So, no. So what we are talking about. So first of all, we need antibiotics. It's clear that both on the human side and the veterinary side, antibiotics are needed to treat bacterial infections. Now we see that resistance is occurring, and it's also what we call a natural phenomenon, but we see that over the years, due to misuse, appropriate use, not responsible use, and again, both in human side and veterinary side, let's say the resistance has become very increasingly high. A part of the, let's say, the public health or animal health issue, there is of course a huge impact also on the economic part. So if we look to the data, which from dates from 2009, is that in Europe, 25,000 people die every year due to not possibility to treat a disease. And also there is this economic part, which clearly explains that the costs, not only healthcare costs, hospitalization, but also the not going to the work, so we speak about 1.5 billion euro. So it's clear that there is not only the animal health, public health side, but there's also the huge economic impact of antimicrobial resistance when we speak about antimicrobial resistance. Second, this is a graph of all the different, let's say, classes of antimicrobials. You see them, and I think we will not go through the list, but the most important is the middle of the slide. And there you will see when those antibiotics have been discovered. And you see that it stops by the end of the 80s, 90s. So since then, no new antibiotics have been produced or put on the market. So it's clear that on the one hand, we have the animal health, public health importance. We have the economic impact, huge economic impact, and also, again, it has an impact on trade, on treating diseases. And also, in addition, that, let's say, antibiotics or the research for new antibiotics or placing on the market of new antibiotics is, let's say, dried up since the late 90s. We have a serious problem. So, okay. Now, when we speak about antimicrobial resistance, it's not something new. So it's clear that since many years, they speak about that we need to do actions on antimicrobial resistance. At EU level, we had what we call the ban on growth promoters since 2006. There had been numerous scientific advices. There had been monitoring. There had been also research. There had been international activities, both at OIE, Codex, and at TATFAR, the Transatlantic Task Force for Antimicrobial Resistance. But the data we have in front of us clearly shows that a lot has needed. So there is the need for additional actions. And that's why the Commission in 2011 presented or adopted this communication. This communication was an action plan, a 5-year action plan. The most important of these communications was that it was an approach with a One Health approach. So it meant that when we want to tackle antimicrobial resistance, we have to cover the whole chain, veterinary side, human side, and all the stakeholders along the chain. So it's not possible that only one stakeholder has to bear let's say, the burden. It's clear that every stakeholder along the chain has to take the responsibility and to act. Second is that the communication was also very concrete. So the communication put 7 areas with 12 concrete actions that the Commission proposed for this 5-year action plan. If you're looking to the, let's say, the different actions, they are, you will see, we have appropriate use, and again, this One Health approach you will see, because both, we have the appropriate use both in human and veterinary. We have prevention of infection. We have new antibiotics, and on the veterinary side, the need for new antibiotics. We have surveillance on both sides, and then we have issues which cover, of course, both. Is international cooperation, which can tackle then both at one time animal health and public health. We have research and innovation, which of course is a very important element. And then we have last but not least is communication and education. So now the idea of the further presentation is to go through and to give you an update. And of course I want to focus on those, let's say, requirements which are of interest of you. So I will focus on those requirements or the actions which specifically are addressed to the veterinary farming world. So first start with, let's say, strengthening the regulatory framework. And in this respect, there are, let's say, 2 ongoing activities which are now in the pipeline or which are discussed both with the Parliament and the Member States. And the first one is the revision of the veterinary medicines legislation. Of course, the main purpose of this legislation is to have and to maintain the use and the availability of antimicrobials for the veterinary medicines. But this specific regulation also covers certain actions linked to antimicrobial resistance. The first is linked to authorizations. So it's clear that when evaluating, authorizing new drugs, there should be a risk-benefit analysis done to verify that the balance between risk and benefits are favorable. Second, the regulation will also provide a legal basis for prudent use. As we know, for the moment, we don't have this legal basis. I will come to that later. So this will also allow, this regulation will allow to have a specific legal basis to, let's say, impose by legislation prudent use. There is also the legal basis to restrict certain antibiotics in the veterinary medicines, which are very important for the human use. And then last is also the possibility to, and this is linked to the collection of data, so that, which is now for the moment done on voluntary basis, there will be also the possibility to have a legal basis to have, let's say, in law, the need or, let's say, the obligation to collect data on the use of veterinary antimicrobials. The second, let's say, legislation is linked to the animal feed, the medicated feed. And here, it's of course, the main purpose is to have, let's say, high quality feed, which we use is of course the prime, when we start about the whole food chain, it's of course the key to have safe feed. So it's clear that the prime, let's say, objective is to ensure for the future safe feed. But also within this revision, there are certain elements to address the risk of antimicrobial resistance, mainly also knowing that huge part of antimicrobials given in the farming world are, of course, given through medicated feed. So the first provision is that this, let's say, legislation will prohibit the use of, the preventive use of medicated feed in the farm for animals. Second, there will be also specific provisions to increase the quality of medicated feed. And also last, there will be also, and this is mainly to address the issue of carryover, that in, let's say, a feed producing company, that you produce medicated feed and normal feed, to address this potential risk of carryover that certain microbials will come into this, let's say, non-medicated feeds. The third action in this relation is that our colleagues from the Food and Veterinary Office, it's part of DG Santé, Health and Food Safety, and they do audits in member states but also in third countries. And the project is running to have, let's say, fact-finding missions in the different member states to see the measures they took at national level, how those measures are implemented and how those measures are working. So it's clear that they have started by sending a questionnaire to all member states to get this initial information, and there will be 7 fact-finding missions in 2016, and by the end of 2016 this will give the Commission and member states a good overview of the different activities in the different member states, but also to see how these measures taken at national level, and then also covering not only the veterinary but also at farming level, how those measures are implemented and also how they work and the results of those activities. Now, referring now to the prudent use. This is Action 3, introduce recommendation for prudent use in the veterinary medicines. And here we have, let's say, existing legal tools. It's not that we have to reinvent everything. So there we have existing tools. There had been reflection papers and also recommendations done by the European Medicines Agency on the use, on the prudent use. And there is, of course, also the possibility to have this, what we call referrals. So it means that both the Commission and member states, and this has been done, that if there is certain risk or, let's say, authorizations from products already on the market, but if there would be a certain risk linked to antimicrobials, then there is a possibility to ask EMA to verify and to look again to this authorization, and this is what we call these referrals, and then to see if this authorization is still fit for purpose or that certain amendments are needed or perhaps some additions to the summary of product specifications should be added in order to ensure or reduce this potential risk of antimicrobial resistance. In addition, and of course not mentioned in the beginning, but of course in the whole issue it's very important to have solid scientific evidence and solid scientific advice. And here of course also the European Medical Agency is very active and provides us different, let's say, recommendations. There had been recommendations on last resort antimicrobials. There will also be a recent recommendation linked to the use of colistin, where they said it should be limited to the use in the veterinary world, but not in a prophylactic way. So it should be to treat diseases. And there is also some additional, let's say, requirements or let's say recommendations made linked to the prudent use of those products. Now, as I said, we have, for the moment, we don't have already a legal basis for prudent use. But from Commission side, we published quite recently, on the 11th of September, a guidance document on prudent use in the veterinary sector. And the main purpose of this was that, of course, a lot of activities are ongoing with the member states. Certain member states are very advanced. They take a lot of actions. They have also big success. But, of course, other member states are perhaps less advanced or they have difficulty to know where to start. And that's why the Commission grouped, let's say, all those, let's say, good practices together in this guideline. So it provides details on, and it's covering not only the veterinary farms, but also industry. So it's a very broad, again, tackling and addressing all stakeholders to look at the possibilities that they can do or contribute to reduce, or let's say to take into account this notion of prudent use. And in addition, there is an annex of this guideline which provides you the full details with links to the different national member states' websites where you can find more details about these, let's say, specific actions in the different member states. A second, let's say, important, let's say, legal, or third legal, let's say, proposal is linked to Action 5, which is the adoption of the proposal of the UE Animal Health Law. So this discussion has been closed. So there had been an agreement from Parliament, from Council, from the Member States, and this has been now goes into the formal, let's say, the more administrative further process for publication by probably in 2016. So also here in this regulation there are specific provisions linked to antimicrobial resistance. The first is about responsibilities. So this regulation, this new regulation on animal health law will clearly define the responsibilities both from competent authorities, farmers and veterinarians, which is quite important that, and this is, let's say, also in the back, that we have this one health approach that every stakeholder should take his responsibility. So this animal health law will provide a specific law or a specific, let's say, a legal basis to push these responsibilities. There is also within the proposal, there is also this notion of categorization of diseases. So this will also allow, linked to the risk, linked to the, let's say, the impact, to have categorization to focus to certain first diseases instead, and have this, to put our efforts in the first disease on the list and having, let's say, less activities on diseases which are, let's say, more down this prioritization list. And then last but not least is that the regulation will also provide a legal basis for monitoring antimicrobial resistance. For the moment we have monitoring in zoonotic pathogens, so we can have surveillance in zoonotic pathogens, but for the moment not for, let's say, the non-zoonotic pathogens, the animal diseases which are not zoonotic. For the moment we don't have a legal basis. This regulation will allow this, provide this legal basis, and this will also allow then for the Commission to present, let's say, a monitoring program, and also to co-financing this program, specifically addressing the pathogens for animal health. Coming now to the seventh action, and this is the promotion of, let's say, new antibiotics in veterinary medicines. In this respect, I come back to, let's say, the proposal on veterinary medicines, which will allow to address, or let's say to create certain incentives for new drugs on the market. This is, for example, linked to a longer, let's say, protection of this this characteristics of the product. So let's say they provide a longer patent for this product, so that this product can be marketed by the company longer time, which gives a better perspective on, let's say, to benefit, or let's say to put it on the market, that they can have a longer benefit of a sort of a sole property of this antibiotic, instead of that it comes on the market and then can be, let's say, reproduced by the generic companies. Then there is a second is scientific advice. We asked both the European Food Safety Authority and the European Medicines Agency was to look to the impact of the measures we want to take, impact at farm level, and to see the impact on these measures on antimicrobial resistance. So this is an ongoing mandate where both agencies are working very hard, and so by the end of 2016 this, let's say, scientific advice will be available. Coming now to action 10, and this is monitoring and surveillance, and this is one, although all the actions are, let's say, considered to be equal, there was no intention to have the first is the most important and 12th is less. But of course, surveillance and monitoring is of huge importance, not only to get a baseline, but also allows us to see how we progress. When we have surveillance, we can see what is happening. We can also see the measures that we take towards implementing measures of certain measures, how they, let's say, affect, or let's say, if we have really effect in the field, and that's why surveillance is quite important. On the veterinary side, we have, let's say, two main projects. The first project is linked to the collection of data of veterinary antimicrobials. This is what we call the SFAC project, which is led by the European Medicines Agency. It's a voluntary program, so it's very nice to see that it's a voluntary program, but where 26 member states participate. So when I said there will be a legal basis for prudent use in the revision of the veterinary medicines, probably we don't need it, because already at, let's say, voluntary basis, member states are participating to collect data and to send those data to SFAC. A second is, this is about the use of antimicrobials. A second, let's say, decision was linked to surveillance and monitoring of antimicrobial resistance. And there, since the 1st of January 2014, we have at EU level a system of monitoring antimicrobial resistance in food producing animals. And most important, Commission will also co-financing, but most important that the data we will collect from those monitoring will be comparable to the human data. And this was in the past a difficulty that surveillance was done on by member states on voluntary basis. But the main problem was that when you have data on the veterinary side, it was very difficult to compare them with the data on the human side. And now, let's say, based on the scientific advice we received, the decision which is now in place, and it's a multi-annual program, will allow to have data, and the first report will provide, let's say, its evaluation is ongoing by the European Food Safety Authority, will then allow to make comparison and also feed in scientific advice later to see the link between, let's say, what we see in the human side and what we see in the veterinary side, because we know that antimicrobial resistance can move in two directions. Then, as I said already, we have the surveillance. This is for the future on non-zoonotic pathogens. And of course, surveillance has only value if we do something with all the data we will collect. So there is now a mandate, it's a pending mandate, what we call it. So it's a mandate where 3 agencies are collaborating. The first report has been presented. It's, let's say, this report of the Joint Interagency Antimicrobial Consumption and Response Analysis, which is abbreviated JACRA. And this report has been published, so it looks specifically on what is the impact of use and what is the impact of antimicrobial resistance in animals compared to humans. And so in the future, when we get new data, we will continue to have, let's say, feed in this mandate, and this allows then the 3 agencies to update this mandate and to provide even more robust data on, let's say, where we are and what are the most appropriate measures to take to tackle antimicrobial resistance. Concluding, I think, first of all, I would like to say that when we look to the numerous actions taken, that it clearly shows the importance that the Commission gave in 2011 to antimicrobial resistance. Huge effort has been done. We went just through, let's say, tackling the main points, but the Commission published in the beginning of this year a progress report where more details are available, and you will find them on a dedicated site of the DG Health and Food Safety, where you can find all those elements. So a lot of activities has been done. but it will remain, and certainly my commissioner in this afternoon will confirm that antimicrobial resistance will remain a priority now, but also for the future. It is clear that we, of course, we have to evaluate now the action plan. The action plan was a 5-year action plan. We launched an evaluation which is now started. The idea is to have, let's say, we have to have, let's say, the conclusions by February next year. And the purpose is to present the conclusions of this action plan during a ministerial conference which is organized by the Dutch presidency, both involving health ministers and agriculture ministers, to present this outcome of this evaluation at this conference. And then last but not least, and this I think it's very important, that when we go back to 2010 and now, we have seen a lot of action plans coming up. We have seen at international level, we have seen at the member states level, we have seen that the stakeholders also took, let's say, presented their action plan. Of course, it's very important that also those action plans are implemented. So it's very important, and this is addressing mainly now for the audience here, farmers and veterinarians, that the actions, let's say, proposed in your action plans, that you take really actions also to implement and to at least check if those action plans are followed by your members and followed and implemented at the field. So thank you.